Hello, good afternoon, everyone. And thank you to be there to this year-end Reconnect webinar dedicated to a transversal subject and topic, very interesting topic for patients and also for physicians on nutrition. And we will discuss about the multifaceted aspect of nutrition for a patient suffering of connective tissue disease and rare musculoskeletal diseases. And lots of questions are coming from patients usually about nutrition. Shall I have a specific diet? Shall I avoid some food or some drinks, etc., salt, etc.? And we have asked to Mauricio Cutolo. My name is Eric Achula. I'm co-chair with Mauricio Cutolo of the Education and Training Working Group for Reconnect. And Mauricio Cutolo is a good friend of mine for 20 years, maybe. We worked 20 years ago with Yolar. We have developed several courses with Yolar, and now we are sharing that task. And Mauricio, who is Mauricio? Mauricio is a former president of Yolar. He's working in Genova in the lab of experimental rheumatology and division of rheumatology, also Department of Medicine and specialties in Genoa University, and also in the Polyclinic Hospital of Genova. So, Mauricio, very happy to co-chair with you this session, and I will give you the hand, but before, think about that. The webinar is recorded and will be published on the Reconnect website, also on YouTube. And for questions, you can use either the question and answer session in the Zoom black bar or the chat, as you want. We will discuss your questions and answer your questions at the end of the webinar. So stay with us until the end, of course. And after, questions will be addressed to the speaker after the presentation, as I said. And we'll see after the presentation. I'm really happy because today you are lots of patients connected. I see 33, maybe 50 now. And we will have sure a nice discussion thereafter. So I stop sharing the screen, give the end to Mauricio. Mauricio, it's up to you.
Thank you very much, Eric, for introduction and all the people that are so much involved in such education. We are managing, as you mentioned, from EULA to Reconnect and vice versa. Nutrition. The nutrition, it's important. We know very much how important it is because we can say that diet and component of the different diet play an important role in the pathogenesis of such many diseases. Think about just gout and chronicity, or maybe co-therapy we will discuss for several acute and chronic diseases because they interfere with the inflammation, immune response, and many other biochemical activities. So, but if we a little of history, because the history is always important when we start to speak about so important topic, and move to Hippocrates, 400 before Christ. What he say? Let your food to be your medicine, and your medicine to be your food. So already 2,500 or most years ago, it was clear that diet, food are fundamental at the level of medicine. But we will see also how may be terrible risk factor and factor that involve themselves in the pathogenesis of diseases. And after this Greek start, practically the Romans started to use foods. Because some of these, for example, fish oil or such they call garum, was used also by the soldiers that moved from the Mediterranean to the North Europe and so on, and they need vitamin, fat, and so on. And they used to bring this garum, that is a content of we will see what. So this webinar will try to explain how the different foods and nutrients may influence our conditions and health, but as well as diseases. So if we consider that the first interaction between the foods and our healthy system is at the level of the gut, the microbiome is the most important component of our living body in contact with the immune systems. And the interaction have a consequence also for long term, for human health. And so it's clear that changes in microbiota of mother, of newborn, may predispose to diseases that is associated with dysregulation, this barrier between the microbiota, the foods, the nutrients, and immune system. Diseases like asthma, allergy, start at this level. And different nutrients may induce dysbiosis, so alter the composition of bacteria that in billion and billion of organisms are part of microbiota. And there are some foods containing, for example, carnitine that may enhance some bacteria, like segmented filamentous bacteria that are, we will see how, enhance the inflammatory reaction. And we know how many diseases, even rheumatic diseases like spondyloarthritis, start with inflammatory bowel diseases. But there are others, components present in fibers. We will see the short-chain fatty acids and bacteria that are give power for such kind of fuel, like a Bacteroides fragilis or even Bifidobacterium infantis, and all of these different components that are positive for the protection of the gut epithelium are, on the contrary, positive nutrients. We can say positive nutrients. So one of the most interesting products of the fermentation of the food in the gut is the formation of the short-chain fatty acid. And we will see the food sources for this and how they work. So are produced in the colon by fermentation of non-digestible carbohydrate, particularly polycarbohydrates, and including dietary fibers. And so food rich in fibers, like we know, vegetable, legumes, fruits, are the best source for short-chain fatty acid. The most important are butyrate, acetate, and propionate. And it's clear now that this short chain exerts an important key role in the immune endocrine regulation, acting on different cells with different mechanisms. But this is well proven. And we will see more and more during the webinar. So it's interesting to see how from what we eat, we modulate our microbiota, and the microbiota interact with the immune system on the epithelium and the plaques of Peyer's and so on. The immune system that in 80% of our body is located here, and the signal will be a signal positive, but also in some condition a negative signal. So you can have with the right content, like short chain, reduction of the negative activity of the most important cells involved in immune inflammatory reaction. So if we look at the diet rich in fiber and with less fat, negative fat, some bacteria, as I also already mentioned, increase, proliferate. It's created microbiota diversity that is very important to modulate very well all the different metabolization of the nutrients and start the production of short-chain fatty acid that interacts with the immune system. This is a very important point. We will have occasion to discuss about this, because the short-chain fatty acid I mentioned before are the most abundant metabolites of the resident microbiota, and so are important play in this crosstalk between what we eat, the source for the metabolization in positive metabolites, and the crosstalk with the immune system. And almost every type of immune cells, from dendritic cells to T cells to macrophages, are in some way regulated by the presence of different metabolites, and in this case, by short-chain fatty acid. And the final result is the downregulation of the local and reduction of the local inflammatory reaction, mean less production of pro-inflammatory metabolite. They are absorbed and circulated and are responsible for systemic inflammation. So, sorry, this is a very important point, the regulation of the immune and non-immune pathways. On the other hand, so if we don't have a diet that may produce the precursor for the metabolization, fermentation of short-chain fatty acid that already we discussed, which is the important action, it's clear that we will meet different situation, not a barrier to the function and tolerance for allergy and so on, but on the opposite side, the enhancement of the capability of react the immune system at the level of the gut. And as I told you, almost 70–80% of the immune cells in the human body are hosted in the gut. You can imagine how important is what happens inside the gut. So if the diet is rich on different fats, but the fibers that are the source for metabolites like what I mentioned, it's clear that we
I think Mauricio is disconnected. Eleonora, can you hear me?
Yeah, I thought about that. Let me double check, sorry.
Okay.
Yeah.
So it's not me.
Okay.
what happened?
Mauricio, you was disconnected, so share again your screen. So it's
I do, but I don't know why disconnected, but
just 15 seconds. Just 15
no
seconds.
No problem. So I restart, as probably some bacteria are nervous, and they don't like to be excluded. And the fermentation of carbohydrate, as mentioned, this is a very important point. You will see why, are the precursor of some of this that I already mentioned, and for the modulation of the most important cells. But even other nutrients like proteins and peptides can also be converted in short-chain fatty acid. It's important to know which kind of protein, which kind of peptides, and the amounts. It's really important, the amounts. So if we consider that other acids, fatty acids, are important for the health, of course, short-chain, we already now discussed that are important. But there are many other fatty acids that we know from long time, and we know the majority of us knows the food of source. And which one is the most important? The polyunsaturated fatty acid, the omega-3. This is a classical population of omega-3 that work exactly in opposite to omega-6. So omega-6 produce omega-6 eicosanoids, pro-inflammatory. Omega-3 produce omega-3 eicosanoid anti-inflammatories. And here again, we know from long that omega-3 possess anti-inflammatory, vasodilatatory, even anti-aggregant activities, properties. And we know very well that the fish, and some fish, are particularly rich of such kind of nutrient. So the family of fatty acids that regulate and control and exert a constant anti-inflammatory activity in the gut, it's very large at the end of the story. But always, and it's clear, the nutrients, the different nutrients are the most important part for this chain. And we know, for example, that the long-chain omega-3 polyunsaturated fatty acids, for example, reduce the production of some of the most active eicosanoic acids that are involved in the inflammatory, and in presence of this omega-3, their production is reduced, LTB4, for example, thromboxane, PGE2, and less immune inflammatory response, as well as also on the membrane fluidity and lipid raft organization. Such kind of fatty acid, polyunsaturated omega-3, play an important role and again contribute to the anti-inflammatory action. Fish, it's important. In particular, we know very well the salmon, wild or farmed. We prefer wild, but soon will disappear. Sardine, tilefish, and so on. And generally, if we eat 3 to 6 portions, that means 85, 170 grams of these kind of fishes 2 or 4 times a week, it's really important and shown and validated and published the capability to reduce the inflammatory reaction and to reduce the risk of inflammation. This is well clear. Olive oil is another important, very common in our area in Mediterranean. And the most important component of the olive oil are the olyneuropane or tyrosol that exert antioxidant activity. This is the most important activity of olive oil that we know. It's so important to either store foods for its antioxidant activity. But this antioxidant activity is really important. It was already tested in several studies. One of the most recent published a few months ago, compare the olive oil regimen with other 6 types of nuts, and to see if there was something of positive clinimetry of rheumatoid arthritis disease activity. Practically at the end of the story, olive oil in significant manner was shown to reduce the SDAI in a very significant way, much more than nuts, but both together even play a role together. But there are several publications. It's not easy then sometimes to distinguish what is true or biased or so on. But let me tell you something more, because our diet is composed, of course, by fatty acid, we have just discussed it, but also by beverages. And beverages are an important component of our daily nutrition. And beverages have a really different effects. And we must know, because we like coffee, but we must know the limit for coffee. We like soft drink, but we must know which kind, or if not at all, roughly. We like wine, but we must know when kind of wine. And so for tea, green tea, and so on, we will discuss now. For example, let me discuss about the red wine. Resveratrol is known as a very important antioxidant component that is present in the skin of the grapes, particularly in black grapes, can I say, and other fruits. And this is known as a very important antioxidant compound, and it is the main component of red wine. Blueberries, for example, are very rich. And the action of resveratrol against stimuli for inflammation like TNF-alpha, you can see here, is a sort of inhibition by interaction with receptors for several mediators of the inflammatory reaction. And in several ways, can interfere, particularly in the intracellular signaling that is, as you know, is driven by NFK component, nuclear factor components. Caspase also is involved and other anti-inflammatory molecules. So the resveratrol is an essential nutrient, but the required amounts are difficult to achieve with the foods or the wine, because if we look at the foods, we should eat kilos and kilos and kilos of grapes and even wine. But there are some kind of wine, for example, Pinot, that is in 1 liter at least 12.59 milligram of resveratrol, and we know that to exert this antioxidant activity need at least 40 milligram liter a day. So that means almost 3 liters of red wine. But just to know that such kind of action is less effective when we drink 2 glasses, because then we have other side effects from alcohol. But is one of the positive effects of wine. But there is another very common drinking, that is the tea. And the tea is also capable to interfere biochemically with several activity, especially anti-reactive oxidant substances, with an antioxidative activity on stress and autophagy. Again, acting intracellularly in the intracellular signal driven by a nuclear factor Kb. And the molecule, a pigallocatechin 3-gallate, that is present in the dried leaves of green tea. Every 100 grams, you have 7,380 micrograms. So it's clear that the quantity is very large, more. It's green, the leaves, than other kind of tea. This action is very important because here there are a lot of publications showing that, for example, this is a recent review, as you can see, that reduce the mitochondrial production of ROS, reactive oxygen species. And so this in some way reduce the inflammatory reaction. So green tea that's suggested to be used in some way really can help, together with other beverage, to keep downregulate the action of several pro-inflammatory cytokines or cyclooxygenases and so on. But what about, for example, coffee and soft drinks? Okay, coffee, it's I think we think the most common beverage, and coffee exerts also important action on circadian rhythms. But we must know that caffeine may also interfere with our drugs that we use in our therapies, for example. And if we use, for example, if you consider patients that for 10 months are treated with methotrexate, every patient will use methotrexate in some way, and are regular consumer of caffeine may compare with the adenosine receptors, with methotrexate, and influence the activity of methotrexate. So may reduce the efficacy. But also, coffee delays the phase of the circadian reactivity, so may alter the circadian rhythm. And this is for several people, insomnia, if they drink a coffee in the evening. So it's induced by caffeine, and may change also circadian rhythms. And you know that for our well-being, circadian rhythm, respect of circadian rhythm, and to sleep at least 6-7 hours is important for the digestion, but not only for the digestion, for all the immune system activity. What we do not have to use are the soft drink, because they contain no essential nutrients, no vitamins, no minerals, no fibers, only artificial sugars, stained with different, some of them cancerogenic paint, and so on. And in addition, if you see this curve, when you use a soft drink, you have a sort of increase the production of insulin, then down, like during the high glycemia load meal. So the soft drinks are poison and should be absolutely not used in healthy condition. I don't tell you in a diseased condition. But in addition, the disruption of the circadian rhythm for people who start to eat in the evening and on is also cause of the loss of the circadian rhythm, and several problems that arise when you are chronically changing the timing for food that is regulated by calories, levels of blood, and so on, may induce bulimia or cachexia, or anorexia, cachexia from another side are involved. The continuous introduction of foods. So it's not a joke. The nutrition must respect even the so-called chronotherapy. But what about vitamins? One of the most important vitamins that is a real hormone we know is vitamin D. This is an hormone like cortisol, sex hormone, aldosterone, same origin from cholesterol. The cells of the immune system downregulated by vitamin D corticosteroid are a lot and exert an immunosuppressive effect or anti-inflammatory. So it's clear, as you can see, even in circadian rhythm of the disease is related to the circadian rhythm of the vitamin D receptors and opposite to the concentration of vitamin D receptors. And as you see at the concentration of vitamin D and the variation concerning the seasonality of disease incidence and severity in patients with chronic disease, you see are opposite. High vitamin D in summer, lower intensity and severity of many chronic diseases in summer, and vice versa when the season change. These all are important aspects. In this study, for example, was shown that the severity of rheumatoid arthritis is much higher in fall and winter than in summer. So the supplementation of vitamin D is fundamental to keep this reservoir, the rescue that will be used and metabolized even peripherally by the immune inflammatory cells. And finally, the powers, the salt. Salt, we know very well that salt is a poison in high concentration, is fundamental for several actions, but this should be not in much high concentration, because the high use of salt, it's well known, increase the proliferation of T70 cells, and so this it's a damage, as well as may impair the function of T regulatory cells, and shift to macrophages from the anti-inflammatory M2 to the pro-inflammatory M1. So chloride, salt, it's to be considered with attention. But rare disease, connective tissue disease mean hereditary connective tissue disease. For example, lichen or Locke, Ehlers-Danlos syndromes. This is a classic example of disease that's inherited with different levels of severity, different types. There are 13 types. But one of these types that is the most frequent is 75%, that is an hypermobility benign syndromes, has not up to now found any genetic reason. And so at this point, the treatment of such kind of patient is particularly related to the capability to enhance, for example, the synthesis of extracellular matrix using ascorbic acid, vitamin C, diet rich on fresh fruits, for example, much better vegetables, physical activity, in order to let these people that have problems related to the excessive flexibility, elasticity of the tissues, to try to enhance the resistance of the tissue to the hyperexcursion and reduce the classical articular or skin or cardiovascular laxity problem that are associated. Of course, there are also some advantages. Look, this wonderful lady that is affected by Ehlers-Danlos, and she works as a contortionist look, and this is not because she's very good, but she has Ehlers-Danlos syndrome and she can do this. These are patients, are not contortionists, but look what they can do, are our patients. So it's clear that here it's important to control the symptoms, inflammation related to hyperlaxity, to give vitamin C in industrial concentration, and fruits, vegetables, and try to reduce as much as possible the elasticity of the tissues with all related problems. Now, just few practical suggestions how to approach which kind of diet use in order to control, reduce the risk, or even control as a co-therapy. For sure, we have a different diets. And you know, the classical diet appreciated in all the world, the Mediterranean diet. But there are other diets like a vegan, calorie restriction, elimination diet. There are some difference with the Mediterranean diet. The Mediterranean diet, as you see, include what I mentioned, but also eggs, poultry, red meal, a small proportion, nuts, and so on. The vegetarian diet, the vegan diet, elimination diet don't include this last part of component. So at this point, no fish, no dairy products, no eggs, no poultry, all of them over a long time induce a dysbiosis, because our microbiota, as we mentioned, need also some precursors that you find, of course, in fresh vegetables mainly, but you need also other components to enhance the capability of the cell to activate, to be activated and react. So if we want to consider this pyramid, how to split our diet in a classical patient with a high activity rheumatoid arthritis, for sure, regular physical activity and water. Water to eliminate drugs, to eliminate compounds, and so on. So water, at least 2 liters. Then, if possible, during the day, 4 or 5 portions of vegetables and fresh fruits. This is very important. Maybe during the midday, during the mid-afternoon, to have some vegetables or fruits. Then important also to consider the extra virgin oil for the reason we discussed. Maybe at the lunch, maybe at the dinner, 1 portion of oil, 1 or 2 portions of oil every day are really important as a source. We already discussed what as well important. You can use a little wine and dietary products if you're allergic to, because not lactamase. You can use products treated, but the introduction of calcium for even the muscle function is very important, the contraction of the muscles. So at least 1 or 2 portions, 1 glass of wine, keep the doctor away, and a day, and 2 portions, as you know, of such kind of milk, for example, or yogurt. Then important is the consumption of fish, fresh legumes, because fish, white meat, 2 or 3 portions a week give us proteins, because we need also proteins and peptides. Finally, never forget the eggs, at least 2 a week, to avoid problems to the absorption of fatty acid and gallbladder. And finally, some meat also may be useful, excluding diseases like gout and so on, acute gout and so on. So here you have an idea how important. Clearly, in Mediterranean, we use also the pasta, and this is, of course, can be continued, and bread with an amount that is not exaggerated, to do not increase too much the carbohydrates. So this is the final situation. The last interesting note that I want like you to smile is an article published recently about pizza margherita. This well-done paper published in Nutrients. We know that margherita is a Mediterranean diet, carbohydrate, protein, fats, all together, mixed. So in this study, we evaluated 100 patients with rheumatoid arthritis, ACPA positive, negative, and using at least 1 or 2 pizza a week, those mind, and or less. And the surprise was that due to the ingredients of the pizza, with regular for a long time, of course, one of the climatic way to evaluate the rheumatoid arthritis activities die improves significantly. This is just to tell you that some of the components we have discussed are important. Pizza may be a synthesis of this. So in conclusion, I want to say that the diet and related component, nutrients that you have, interacts with microbiota, produce metabolite, and play an important role in prevention, but also maybe consider a reasonable kind of co-therapy, if you want, in the field of connective tissue disorders. Thank you very much, and here my co-workers in Genova, and I'm ready for questions. Thank you to all of you.
Thank you, Mauricio, for this really, really nice, interesting presentation. I have taken lots of notes and will follow your recipe, your final recipe, we'll see. So we have several questions coming. I think the attendees were some physicians and also some patients. We have both types of questions. So the first question is, how about the consumption of soft drinks that have no sugar but artificial sweeteners? What is the current evidence for this sweeteners? Is this useful to drink soft drink but without sugar, with sweeteners only?
I understood. Well, it's clear that the most dangerous component of soft drink is the artificial sugar are inside. This is well known. Absolutely. But depends what kind of soft drinks you consider, because some consider have a basis of natural fruits, okay, where is added maybe a little color, a little sugar, and so start from natural component, orange juice from orange of California, for example. And here, sometimes you don't need even to add nothing. This can be used, of course, but soft drink, energetic drinks that are a bomb of chemical components, absolutely not. So soft drink with a natural component, blueberries, blackberries, oranges, lemon, with lemon, oranges, blueberry, no problem. But if it is artificial blue and sugar artificial, pure energy, pure calories, and no.
Okay, I agree with that.
Thank you.
Professor Cutolo, thank you for amazingly useful lecture.
Yuri?
For your amazingly useful lecture. So it's good. Congratulations.
Thank you.
May I ask you one question? What is an optimal level of serum vitamin D for our patient with autoimmune disorder?
Very good.
Shall we advise level cutoff, minimum cutoff?
Yeah. You mean the dose you have to introduce, or the level in the blood?
Level, yeah, the blood level.
Perfect. We dose the 25 hydroxylate vitamin D. That is the most stable form in our blood. We never do evaluate 125 because this is the final one. So we discussed about 25 hydroxylate. The old limits are now not anymore acceptable, because are not sufficient to help and be transformed in the body by liver, kidney, or inflammatory cells in the active metabolite. So the level must be considered today to exert a rescue amount, and even intervention amount is between 40 and 80 nanogram per milliliter, for liters, okay? Nanogram per liter. This is the value. In the past was considered over 20 sufficient. Now we know that it's still too low, must be over, possibly around 80 nanogram per milliliters. This is perfect, no toxicity, I treat from decades patient. The level I keep is 80 and patients stay very well. No problem, no toxicity. Even because our cells have a system of degradation when you have an excess. When you give once a month 10,000 units, 100,000, this is a mistake. Because after a few days, the 124 alpha hydroxylase, that is not the 125 but 24, degrade to avoid toxicity. So after a few days, you have much less than you expect. And after 15 days, you have zero concentration induced artificially. So it's better every day, 2,000 units a day for 20 days a month, for instance.
Okay, so good advice. Because lots of people are prescribing once a month. So it's a mistake.
Yeah.
Okay.
It's not my wording. Olik, the maximum expert, say that. Ferrari people say that.
Other question. Is the avoiding elimination of gluten something to consider for someone that doesn't have gluten sensitivity?
To avoid what?
Gluten.
Oh, yeah. Gluten, yeah. Here is a question much more indicated for specialists on celiac, because it's clear that we know that gluten generally is associated with some deficiency, enzymatic deficiency, so may induce at the level of microbiota some reaction, and we know, we discussed this afternoon, how is reactive the immune system at this level. So I cannot give a final answer to this, because it's not my expertise, the celiac syndrome.
Yeah, actually, I have the same and other question concerns that, because sometimes people have a celiac disease, but sometimes only gluten sensitivity. And it's true that some patients suffering of rheumatoid arthritis are telling that I avoid gluten and my arthritis is getting better. What do you think about that? Shall we advise patients to continue that diet, or to be careful about that diet?
The diet must be complex. Everything must be eaten to have something of everything, especially with the aging, because the absorption is reduced and many other things. So this is clear that gluten induce problems in malabsorption, avoid. But it is not so clear, and you have evidence, you can test once a week, 2 weeks, and the foods that you like, you can eat. But depends from the reaction of your body. And you know, over the time, due to the epigenetic action, due to the therapies, sometimes this attitude is reduced the intensity, even the symptoms. So maybe you can try after some therapies or diet or fasting to reintroduce some foods, and sometimes you don't have the same strong reactivity, or may appear in other periods when the barrier is altered for other reason, and so many other antigens may act as a trigger for the inflammatory reaction, and so bowel inflammatory disease.
And concerning specific diets, also some patients are saying that avoiding milk, for example, reducing milk, le lait, milk, reduce the inflammation of my joints. What do you think about that?
Honestly, I never read a clear theory about how milk and can increase the arthritis. Okay, of course, part of the symptoms of the inflammation, if you are intolerant to lactulose, it's clear that having not lactamase efficient, you can add symptom to symptom. So if you produce 100 molecule of TNF-alpha with an intolerance, maybe you produce 120 molecules, and seems that your disease become more active, more severe. But that milk induce arthritis, I don't think so. Even do not accelerated is not what I told you, that start an intolerance to the lactulose. For sure, usually having to suggest to introduce calcium with a dietary product. We prefer the chèvre, cheese, yogurt, and milk that is less fat and it's much better, easy to absorb, and the content of calcium is higher. So this is maybe a trick to try to keep the milk.
Okay, next question. You recommend olive oil, but what about ginger oil? You think it's also a good idea? Ginger, le gingembre, gingembre.
Ginger?
Ginger oil. G-I-N.
No, I don't know what about this. No. There are some theory about ginger that may, there are several papers showing that ginger may act positively, but I don't have experience. And I don't think it's comparable to olive oil. It's not so comparable.
Okay.
Are completely different sources. Yeah.
What about night shadow vegetables like tomatoes, paprika, aubergine, etc.? Mediterranean diet?
No, absolutely, there is no contraindication because I saw many studies on red pepperons, for example, paprika and so on. If you don't have, again, a particular intolerance, mixed with the foods, many nutritionists suggest dry pepperons because it's tasty. When you have to reduce your salt in your food because you have hypertension or you have other problems, and you like the foods to feel something exciting like salt, to use dry pepper or garlic, dry garlic, onions, and so on, to have a stronger taste, to avoid sodium chloride. I do this, and it's pleasant.
Yeah, so good advice. You spoke about microbiota and interaction with the immune system. In case of autoimmune disease, connective tissue disease, do you think it could be helpful to change the microbiota? Is that possible to change the microbiota with food, with microbiota transplant? What do you think about?
This is started this idea years ago, in particular Yehuda Schoenfield in Israel started to discuss about this. And it works as a sort of transplantation. If you transplant feces at this point with the high content of the right bacteria for some time, at least you have an improvement. Not so crazy idea. But on the other side, there are several probiotic products that in some way may mutate this very hard way to change or to modulate the microbiota. So probiotics are the enemies of antibiotics. And so it's good when you have reached your target with antibiotic to stop an infection, to give after probiotics, to reconstitute the normal life for these billions of citizens of our gut.
So we had a question about probiotics. So better probiotic rather than stool transplant, effectively. That could be interesting. So I think that's all concerning the different questions. What I for summary, I think Mediterranean food, okay. So fish 2 to 4 times a day, okay. Olive oil, okay. Red wine, Pinot Noir, just one glass every day. Maybe some gray tea also every day. Not lots of coffee. Vitamin D every day. And so also an apple, keep so Dr. Ray. and at the end, And I think it's good. You finish your presentation with adapted physical activity. I think this is this must be added to a good diet. So really, thank you for that presentation, and see you next time.
Of course, thank you to you and to let's stay
And
up.
thank you, and thank you everybody for this nice discussion and questions. Ciao,
Bye.
ciao.
Ciao.
Bye.
Thank you very much.